Good afternoon. My name is Stephanie Board. I'm a VP of R&D at Boston Scientific in our interventional cardiology group. I'm super excited today about this virtual program, and I want to thank everyone for joining us. Hopefully it's a good break to your day. Before we get started, I'd like to mention that there's closed captioning available throughout all of our presentations this week. And for those of you that don't know, we have presentations throughout the whole week, so stay tuned every day. They're short, but should be fun. Medical technology and life sciences are an important part of the Twin Cities community, economy, and educational system. Minnesota is a leader in healthcare. We lead development of medical devices. We lead in providing innovative models of care and in medical education. And so with all that said, as the definition of healthcare changes, so much the medical community. This includes bringing new voices and perspectives to healthcare. We need each of you joining us today to bring your voice and your perspective to make a difference. I want to thank each of you for your attendance during these unprecedented times. I'm thrilled to co-chair this week-long event with my colleague, Randy Schistel, and I will turn it over to Randy.
I think you're on mute, Randy.
Thanks, Steph, and welcome, students. My name is Randy Schistel, and I've been working at Boston Scientific for 20 years now. I work in product development and work to bring new devices to market, working to build a healthier community and helping people feel better with whatever problems they might have from a health perspective. Two main reasons why I got involved with the American Heart Association. Number one is a family history of heart disease, cardiovascular disease. And number two, working in the medical device field. There's a lot to offer, a lot to bring to the American Heart Society, American Heart Association, and to the healthcare community. The annual Advancing Sciences event brings students into an environment where they can learn directly from local leaders in science, technology, engineering, arts, and mathematics, also known as STEAM. Now more than ever, the American Heart Association and our executive leadership team remain committed to inspiring the next generation of scientists and innovators. I want to start by thanking the leadership team who helped create this unique week-long series. This week, we are offering a 1-hour virtual session each day with updates from local leaders, access to great science-focused feature sessions, speed mentoring, and a keynote address from Jayshree Seth, Chief Science Advocate at 3M. Each session is hosted on WebEx, which might be new for some of the students, so I want to walk through a few housekeeping items, some of which are included on page 5 in your student packet. We ask that attendees remain muted and leave their cameras off for the entirety of the week-long series, the entire week, except for the speed mentoring breakout sessions on Tuesday and Thursday. We will prompt you when it's okay to come off mute and turn on your cameras. We do, however, encourage you to interact with the chat box, to ask questions and participate in any trivia. Make sure you set your chat box to send to everyone, and please be respectful with your comments. You can also modify your screen view by using the controls just to the left of the participant box. Steph?
Yeah, thanks, Randy. So before we get started with our featured session, I want to introduce my friend Holly Mesick from the AHA. She'll share more about the organization and the impact that we're making across Minnesota. And while she gets ready to join us, I'm going to give you the first trivia question. When was the American Heart Association founded? And I believe, or the answers, so pick an answer and we'll see who wins or how many people win.
Thank you, Steph and Randy, for chairing Advancing Science this year and for hosting today's Advancing Science session. My name is Holly Mesick, and I'm the Executive Director here in Minnesota. For nearly 100 years, we've been fighting heart disease and stroke, striving to save and improve lives. Specifically, We were founded by 6 cardiologists in 1924. So lots of answers that were correct in the chat box. Thanks to everyone for chiming in and making this interactive. That makes the day more fun for all of us. I appreciate that. You know, as heart disease remains the number one killer for so many Americans, we at the American Heart Association know how important it is that more students like you all explore careers in science, technology, engineering, arts, and math. STEM and STEAM are the future. And as a science-based health nonprofit, this is a big priority for us, which is why we're doing an event like this. Even though we can't be together in person, we're doing it virtually because it is so important. So I really just wanted to share some of the things that we've been doing since 1924. We have invested over $4.5 billion into research, and that's more than any other nonprofit in the United States. And we're only second to the federal government. In fact, we just have been coming off of our Super Bowl of Science scientific sessions over the weekend, and I was re-listening to some of what took place on the weekend and hearing some stories of young investigators who have built these incredible careers because they were started with funding from the American Heart Association. And so since our beginning and in our present, we are very committed to making sure that we're getting these incredible minds on the most important things for our society to flourish. And I just wanted to let you know about 2 local things. We just recently funded $200,000 to the Mayo Clinic here in Rochester for a study they're doing for the fight around COVID-19. We did a fast action grant process, which took place right when the pandemic was starting to really take hold of our country, and Mayo Clinic responded quickly with a study and received funding. So couldn't be more proud of that. And then we just launched a Minnesota Business Accelerator on November 1st or November last week. These months are kind of blurring together. I don't know if they are for all of you out there, being at home every day and working from home and not being in a normal routine. But we just launched a Minnesota Business Accelerator. And what we're looking for is women entrepreneurs who will help us with their ideas around improving health equity for women of color. And so it's really an opportunity for the American Heart Association to put funding right back into our community here and really inspire that next innovator who's going to make real change for people in our community. So wanted to share that to you. And now we're going to take a look at the impact of advancing sciences and some of the innovations our research has created. Truer words couldn't be said that we look forward to being with you all at an in-person event sometime soon. It was fun to look at all those photos, and it made me long for a time when we were all together. I did want to take this opportunity. You saw the last slide that listed out all of our sponsors. We couldn't do our work. We couldn't do this event and many other things we're doing in the community without incredible sponsors. So you'll see all of them listed here. I also wanted to let you know we have this really dedicated and passionate group of volunteers we call an executive leadership team, and they're all featured on this slide. And I just want you to know that their hearts were so invested in creating this week for you and making sure that they help you engage in a way that they would have liked when they were building their careers. So please know that there's been a lot of passion put into this event this week. And then finally, I wanted to just thank Steph and Randy for being our chairs and for being the ones to lead this session today. Really appreciate you, Steph and Randy. And without further ado, I will turn it back over to the two of you.
Hey, thanks, Holly. Thanks for sharing all the great efforts around the American Heart Association, particularly in STEAM. As you know, I'm very excited about STEAM and getting students more involved. Watching that video made me wish we could be in person again, but we're going to do the best we can here virtual. So we're going to jump into our first featured session of the week, hosted by our Boston Scientific team. They're going to guide us through a deep clinical deep dive into our IVUS, or intravascular ultrasound system. Before we turn it over to them, I'd like to remind you to please leave your cameras and microphones off. Also, you can adjust your screen view using the controls shown here. Boston Scientific team, please join us now. We're looking forward to the session. Thank you.
All right, everyone. Hi, everybody. My name is Matt Nurnberg. I'm going to kick us off here. So we are the Boston Scientific team here in interventional cardiology. We're going to give you guys a cool demo. So you just heard from Steph, who is our VP. Everybody here in this lab that you're going to see soon, we all report up to Steph. We've got our names listed as well here, so you can see who we all are. And just quick format and agenda. So again, Steph kind of already hinted at this, but we really prefer this to be an interactive session. So please type any questions you have into the chat or answers to any trivia questions. At the end, we can open it up to any Q&A if you guys want to do that as well. Agenda-wise, so we are going to talk about what we do here at Boston Scientific, specifically in interventional cardiology. We're going to talk about heart attacks. A lot of people don't actually know what a heart attack is when it's happening, so we're going to tell you exactly what it is. We're going to learn about your coronary anatomy, or otherwise the plumbing in your heart. Steph hinted to, the product that we're going to be talking about today is called IVUS. It's an intravascular ultrasound product that actually allows us to look inside your arteries in real time. We're going to show some actual case examples and a live demo, but don't worry, it's not on a real person. And I will hand it up.
Okay, hi, I'm Haruka Imura. So I'll be telling you a little bit about Boston Scientific. So Boston Scientific, we have 36,000 employees worldwide across 120 countries. We develop and manufacture over 13,000 products that help treat 30 million patients a year. Our mission is to transform lives through innovative medical solutions that improve the health of patients around the world. Boston Scientific has a number of divisions. Within the heart, we have interventional cardiology, structural heart, rhythm management, and then we also have peripheral interventions, endoscopy, urology and pelvic health, and neuromodulation. Our team here today, we're part of the interventional cardiology division, and we develop minimally invasive innovations to help treat patients with heart and vascular conditions. And within interventional cardiology, we are in the PCIG group. So we work on the percutaneous coronary intervention guidance products, where we develop products that help physicians make decisions on how to best treat patients. So what does a medical device R&D engineer do? So contrary to what you might think, we don't just solve complicated equations and do a bunch of number crunching. We also do some clinical stuff. So for example, we meet with physicians and nurses to understand customer needs. We watch live cases and observe how our product is used. We also do a lot of collaboration, such as we collaborate with engineers, scientists, marketing, legal expert team members to brainstorm creative solutions to challenging problems. And we also keep learning. Learning doesn't just stop at school. We learn about new technologies and find applications for them, and we continue developing our technical and leadership skills. Ultimately, we do all this to develop products that improve people's lives. Within the medical device industry, there's a lot of different types of engineers. It's not just R&D. So we have engineers who develop new products. So as part of new product development, we also have engineers that keep the current products up to date or sustain the products. Also, we have the R&D engineers that design the product, but we also need process development and manufacturing engineers to build the product. And then also our design assurance and quality engineers make sure that our products are safe for patient use from beginning to end. Next, I'll hand it over to Jenny.
Thank you. All right, time for your second trivia question. So get ready to answer in your chat. What is a heart attack? Is it A, the flow of blood is blocked to the heart? B, your heart stops beating? C, the muscles in the heart are too weak to pump? Or D, a 2013 pop song by Demi Lovato? I know, D is pretty tempting, but it's, drum roll.
Everybody thinks one D so far.
A, that's right. So for those of you that are answering A, it's flow of blood to the heart is blocked. So what is a heart attack really? Your heart serves as a pump. It serves as a pump to take deoxygenated blood and send it to the lungs to oxygenate it and send that oxygenated blood back to the rest of every muscle in your body. Your heart is also a muscle, and in order to continue to make that muscle keep moving, it also needs oxygenated blood. So what a heart attack is, and you can see the coronary arteries are our main vessel and how that oxygenated blood feeds the heart. That's circled in yellow. So that's the anatomy that delivers that blood back to your heart. So what a heart attack is when those coronary arteries get blocked and we're unable to deliver the blood to the heart. And that starts by a process called atherosclerosis, which is a buildup of cholesterol and fatty deposits over time that harden into something that we call a plaque. A plaque sometimes can then rupture, which then triggers an immune response by your body that actually ends up blocking your coronary artery so that the blood, the muscle in your heart no longer receives that oxygenated blood and you see cell death. And then that what reduces the efficiency of your heart pumping, thereby causing issues, which I have a video here that will play.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death.
So this picture shows you what the inside of your coronary artery looks like and the disease progression that I was just describing. So on the far left-hand side, you see the kind of initial, what your healthy vessel looks like. And as you progress to the right-hand side of the image, you can see we start with a fatty buildup, which then, as it moves in complexity, turns fibrous. And the final stage is the complex lesion, which is usually calcified at that point. and where we can see a lesion rupture, leading to the process that we just described in the video. So what do we do about that? As Haruk was talking about, our group works with the percutaneous coronary interventional space. So there's multiple different ways that you can treat this type of disease. We focus on the interventional piece. So what that basically means is a physician will take a needle and can enter your arterial blood system through your leg and bring a small tube up and pass devices through your arterial system that way directly to your coronary artery. And one of those, there's lots of different ways to do that interventional treatment. One of those ways is called a stent that I have pictured here. So at a high level, how that process happens is, like I said, a tube with a stent and a balloon, or the balloon underneath the stent is inserted into that area of disease. The balloon is then inflated, that then expands the stent and kind of pushes that disease out of the way, and then the stent remains in place, keeping your your coronary artery open, thus reducing the risk of heart attacks. In order to be able to treat those type of vessels, though, we need to be able to see inside to understand what the disease state is. So there's two different ways of doing that. One is called angiography. So angiography is basically fluoroscopy, where we first inject a liquid called contrast, which is radio-opaque, and then allows the physician to be able to see where blockages are in your coronary anatomies. So in that first image, you can see that's a good image of the coronary anatomy, and where the arrow is pointing to is where we have a diseased area. And you can see that there's a narrow spot where you don't see a vessel outline anymore. So that's one way that we can see, but the other way is with IVUS, intravascular ultrasound, which helps us actually be able to see inside the vessel. So not just from a two-dimensional image, but actually what's going on inside.
Hi everyone, my name is Viola Holman and I am an R&D engineer here at Boston Scientific, and I have another trivia question for you. So what is a medical procedure where ultrasound is used? Is it A, to diagnose gallbladder disease, B, guide a needle for biopsy or tumor treatment, C, view the uterus and ovaries during pregnancy, or D, all the above? So go ahead and send on your answers into the chat. I'll give you guys a couple more seconds. Thanks everyone for responding. Awesome. So you guys answered D, that is correct, all of the above. So the actual definition of diagnostic ultrasound is an imaging method that uses high frequency sound waves to produce images of the structures within your bodies. This technology is really cool because it's used across a variety of different procedures. As you can see below, I've listed a couple of them for you guys to look at. So to give you guys a little bit more about the science behind ultrasound technology, we have a video so you can kind of see what's going on within the body.
The heart of most ultrasound systems is a device called a transducer, which uses an array of piezoelectric crystals. A piezoelectric crystal vibrates when an electric signal is applied, producing high-frequency sound pressure waves, which we call ultrasound. More importantly, this type of crystal can also work in reverse. It can produce electrical signals when it detects high-frequency sound pressure waves. When a transducer directs ultrasound waves into the body, they pass right through the skin and into the internal anatomy. As the waves encounter tissues with different characteristics and densities, they produce echoes that reflect back to the piezoelectric crystal. This happens more than 1,000 times a second. Returning echoes are converted to electric signals, which a computer converts into points of brightness on the image, corresponding to the anatomic position and the strength of the reflecting echoes. A medical transducer contains a large array of crystals, which allow it to make a series of image lines that, together, form a complete image frame, called a sonogram. In addition, all the crystals are repeatedly activated many times in such a way that 20 times per second, so that real-time motion is displayed in the ultrasound image.
Great, so what does this have to do with Boston Scientific and today? Today we're going to talk to you guys about IVUS technology, which is that intravascular ultrasound. This is a test that uses waves to see inside of blood vessels, and this is really useful for evaluating coronary arteries and their supply to the heart. So all the way on the left, you guys can see an image of what an actual catheter lab looks like. That C structure is actually the X-ray machine. Behind is a monitor so the physicians can see what's going on during the procedure. And then in front are our devices, one of which being the motor drive unit. The motor drive unit actually drives the catheters through your body. Catheters are shown in the upper right. They kind of look like snakes, and inside of these catheters are probes. These probes are actually the pieces that do the IVUS technology. Below is a cross section of inside of the artery. So next we have an IVUS demonstration for you guys. So this is a cross section of an artery. You can see the probe or the catheter going inside, rotating as it takes that IVUS image. Not only is it rotating, but that motor drive unit simultaneously is pulling it back. This allows for not only a cross-sectional view, but kind of a pipe long ways view. This is really beneficial in stent placement.
Okay, so here's a picture of what the inside of your coronary artery looks like on an IVUS image in a healthy, normal vessel. So you can see in the right-hand picture is that IVUS image, which that kind of dark line, that circle around is really the outside vessel border with the lumen on the inside. So basically you can see the coronary wall and there's no disease around it. Now we have 3 types of image that indicate to the physician that there's disease and might be a spot that they want to consider a treatment. These images also help them to decide what kind of treatment that they should use. So on the left-hand side is that corresponds to that early stage of disease that I showed you earlier with our fatty or soft plaques. And you can kind of see now, see if I can go backwards, see how that thin line on the first image is now sort of expanded and there's stuff in between. And you see sort of that fatty plaque. The second in the middle, that fatty area is starting to get darker as the disease was progressing. And now we see more of a fibrous plaque. The final stage of the disease on the right is the calcified plaque. And actually here now you can't even see that real vessel or lumen wall anymore because calcium is dense and it's bright because we see actually the sound waves reflect back off. So you just see kind of a bright white image on the ultrasound.
So now we're going to show you an example of an IVUS case. This is going to be just partway through the case. But we can see on the left-hand side is the physician is now loading our catheter onto a guide wire and then feeding that into a guide catheter, which is then going to track all the way up to your heart, and then it's going to be inserted into the body. And then on the left-hand side, again, on the upper one, you can see, and now you can see in the lower one, our motor drive unit. So as mentioned earlier, this is what connects our catheter to the rest of our system. And this is also what rotates our transducer so you get that 360-degree cross-sectional image of the inside of the vessel. So now you can see on the right-hand side, they've started imaging since they're inside the body, and they are advancing the catheter to where they want to image. And once they get there, they're going to push a button to start recording and what we call the pullback, which is that slow pulling back of the transducer throughout the vessel. And along the bottom of the screen, you're going to see that pipe cross-section, long view, that Viola was talking about earlier. This image is being taken midway through the case. They've already implanted a stent. Like Jenny mentioned earlier, that stent is one way to treat diseased vessel. These stents can be observed by these short white lines along the inner wall of the vessel. And what the physicians are trying to see right now is how well they've treated that vessel. So they're looking for 3 things. One is the vessel sufficiently opened up enough. And if not, they can go back and treat it further. 2, is the stent fully opposed or fully up against the vessel wall? And so they just don't want to see a gap between the stent and the wall. And if they do see that, they'll want to go back in and make sure that they open up the stent enough that it's flush against the wall. And the third thing they want to check is whether there's any damage to the vessel. So depending on the severity of damage, if there is any, they might want to go back in there and treat that damage as well. So now that they've gotten the full region of interest that they're interested in, they're going to go back and manually move the transducer and double check the areas that they're interested in. So you can see Some of those short white lines, those are the stent struts. You can see the bright white lines that go a little bit longer. Those are the calcifications. And once they've confirmed what they're looking for, they can stop the imaging and remove the catheter from the body and continue on with their case.
Hello, my name is Seth Stomberg. I work in the design assurance group here. So basically what we do is my group actually works to try to develop tests to make sure that the medical devices that we make work. One of the most important things is making sure that they are robust and that they don't injure the patients. But we also want to make sure that the devices work as intended. Basically, when we design a product to do something, we want it to do that. My group actually works to try to replicate a lot of the human body scenarios or simulate what the human body is doing. Whether it's the anatomy, the blood flow, and body temperature, those are all things that we consider when we're designing some of our tests. From that, what we do is we actually create acceptance criteria as to what are acceptable and unacceptable products so that we can test against that. What I'm going to show you here is some of the testing that we have developed for some of our IVUS catheters or our ultrasound technologies. As you see here, what you're seeing there in the bottom left hand is the fixture that we'll actually kind of show you here in just a minute in a demo. What we want to do is we wanted to create a scenario. So we created basically a tray or something that could be the IVUS catheter could be put into to actually replicate the human anatomy. So there's a couple of things that we had to go about doing in order to make it look like an actual human vessel. First thing is that we needed the blood to look real. And in order to do that, there's a couple of things that we ended up learning. The bottom left image there is an example of some of the simulations that we did early on where there was no blood speckle. Now we looked at that and compared that to some of the clinical images. And typically when you're seeing a clinical case, the image just to the right of that where you start seeing that white speckle is how the blood shows up under this ultrasound. That's because you have blood cells and all of that moving through the body. The other thing that we needed to do was make the tissue itself look real, or the vessel. And so on the right-hand side, what you're seeing there is a couple different varieties. Basically what we did is we took a very soft material and added fibers in it to try to make it look more like a human vessel. Now, one of the things that we really wanted to do is we wanted to make a diseased tissue layer. The technology that we have, the IVUS technology at Boston Scientific, has a feature called Trace Assist Plus. What that does is it really allows you to determine the thickness of the diseased tissue. This helps you figure out what kind of treatments you're using, but also what size stents we're using, for example, so that the physician really knows before they actually get in to do the treatment what the vessel actually looks like and how much diseased tissue there really is. So what we have here today is we have a demo of the system that we're going to move to that we're actually using to create some of these images. And you'll be able to see how the whole setup looks. All right, welcome back. So I just want to show you, so this is a setup exactly what we have. So our goal here really is to replicate the human body. So for that, what we have is we have a molded silicone vasculature, simulated heart. And if you remember the images, here is a version of what we were talking about, where we actually have this material that we've developed here inside, and we have the appropriate catheter snaked all the way through. So what we're really looking to do is both an approach and anatomy, and also that we have a tank that's heated and we have fluid flowing through this. This is similar to the clinical procedure that you would have seen. There was actually a motor drive unit right here. Here is the actual IVUS catheter and all the interfacing devices. So in order to start a procedure, what we're going to do is we're going to turn the ultrasound image on. Now what that'll do is on our system over here, we're going to start seeing a live image of what that looks like. And what we're going to do is we're going to start a pullback right now. The first part is actually a hard plastic, but then you'll see once we start moving into our simulated tissue, right there. So now you see that depth into there, and we have that ring that represents very similar to what you saw in a lot of the clinical images that we were looking at. It has this diseased tissue shape, and we can also change how bright that is to try to image very similar to different types of diseased tissues. So stopping this image here. What then the physician can go back and do is they can go back and actually take measurements on this. So this is that Trace Assist Plus feature that I talked about. There it is, actually running, doing an analysis. And what you're able to do then is figure out how thick the diseased tissue is. All right, moving on to a little quiz. So what we're going to have you guys do is we're going to have you see how good of doctors you really are. And we're going to see if you can determine the differences between what an actual clinical IVUS image is and the simulated lesions that we've created here. So what I want you to do is there's going to be 4 images that are going to come up. What I want you to do is identify which ones are, or let's pick the 2 that are Boston Scientific made. So there's 2 of them. I'll give you that hint that there are 2 of the 4 that are Boston Scientific made. Pick those out and then post your results in the chat. Right. Running down time. Anybody keeping track of that 15 seconds?
I think 5 more seconds.
5 more seconds? All right. B's and C's. Oh, there. A lot of variety here. So it seems like we have some people fooled as to what's clinical and what's not. All right. Here comes the answer. The answer is A and D were created by Boston Scientific. So as you can see, it's that's our goal, was to make this as close as possible to what the actual clinical images look like. So, all right, that completes where we're at here. I think at this time we're going to open it up to questions.
Yeah, any questions on anything we presented or for any of the team members? I don't know if you've got the camera on. They see us?
All we ask, how many different stent sizes are there?
That's a Haruka question.
Oh, God.
Repeat the question. They can't hear me.
I don't know off the top of my head. There are quite a few, though.
Lots.
Anywhere from about 2 millimeters in diameter up until 5 millimeters, I think, is our megatron sizes. Or like 0.25 increments. So I guess you can calculate approximately how many there are.
What's the favorite part of your job?
Oh, I'll take a stab at that one. My favorite part of my job is I get to talk directly with physicians a lot, physicians and technicians and people that use our system. So it's usually a pretty long process by the time we talk with them and find out what exactly, and my job is really to just kind of investigate, what are you missing from your clinical practice today that would help things make it easier on you, better for your patients. So that's the upfront, really fun part. The even better part is at the end, after we've designed the product, getting to give it back to those physicians and see how happy and how excited they are when we've actually designed something that meets their needs and they know it's going to help drive their clinical practice forward. That's my favorite part. Does anyone else have a?
Well, my favorite part is also similar to that, but I also love like the products we work on. We have teams for that. So you know, we go through a lot of challenges together. So what does it break us, makes us like stronger, makes us closer. Like it really brings us closer together. So I really enjoy that team aspect of it.
I guess I'll go. One of my favorite things from a test development standpoint is coming up with having a problem and coming up with an idea and then seeing that executed and actually built into something that's real, and a design solution that can actually find that. The other thing is hanging out with the great people at Boston Scientific here and the great crew that we have. So.
Good question. Anyone else have anything they wanted to add?
Yeah, somebody asked, what are some other ways of treating disease besides that?
Oh, yeah. Actually, you want to take a stab? You know more than I do.
Okay, so there's a couple different ways you can treat it, and it depends on what kind of disease it is. So if it's that fatty plaque that Denny was talking about earlier, it's softer. You can also treat with a balloon. We have, there's also balloons that are coated with drugs that you can just use without a stent. We have different kinds of stents. We also have for calcific lesions, we have a couple of products. So we have a cutting balloon, which is literally a balloon with razor blades on it. So it just sort of cuts into that calcium that later can put a stent in, so fully expand. We also have an atherectomy device, which is a diamond-coated burr, which will rotate tens of thousands of RPM, up to like 100,000, 140,000 RPM, and you can sort of drill through that hard calcium before treating it with, again, a balloon or a stent afterwards.
And part of why the IVUS technology is so cool, because there are so many different ways that Virgo was just describing to treat. It really helps physicians get a better understanding of what's going on inside the vessel. Like when I kind of showed that angio image at the beginning, that really just kind of gives you an idea that there's a narrowing. It doesn't tell you what that narrowing is. So IVUS helps get to that next stage so they can determine which type of treatment that they want.
How long does it take to create a new product?
How long does it take to create a new product from beginning to end? That's a great question. A lot of it, I would say for the actual development, so it definitely depends on the complexity of the product that you're working on. I've worked mostly with software and hardware in my career, and it's usually a year to a year and a half. The tough part is the back end, is how much work you have to go through to submit your product to different regulatory bodies. So anytime we design a new product, there's varying levels depending on how invasive the product is. There's varying levels of regulatory work that you have to do to submit it. More invasive or direct treatment procedures require a longer regulatory timeline, so the development takes longer. Some of the products I worked on was closer to a 3 or 4 year timeline for those. I don't know if anyone has a different answer if that. We saw some nodding. So
yeah, I think for catheters, for single-use devices, it's typically 2-3 years as well. Yeah.
Another question is, curiosity, how long has everybody been working at Boston Scientific?
Great question. So I've been here about a year, and I've been an engineer for about 9 total, I think, if I can count.
Yeah, I've been here for 7 years, and I've had basically my full career at Boston Scientific.
It started at the beginning of the year, so.
I've been here for almost 4 years, and this is the second place that I've been in my med device career.
I'm on year 7 now after spending 5 years in the CRM division. Now I'm here in interventional cardiology.
Oh, another
question here at the end. What college degrees allows you to get jobs like this?
Wow, that's a really good question. I'll start because I have probably the strangest path again. So I actually got my degree in genetics and ecology. And so I have a biology background. So I then actually worked at a zoo and then a vet clinic. And I worked with more like early clinical type roles prior to moving into engineering. So I have more of a strong background in anatomy and physiology. And then I kind of translated that and found an opportunity at a medical device company where I could kind of marry my physiology and anatomy background into kind of designing products to help diseases. So that was my background.
I definitely went a different route. So I majored in mechanical engineering. I did a biomechanics track and I actually minored in business. So with that, in those classes that I took, that's kind of how I ended up in the med device field.
I did my undergraduate degree in biomedical engineering with a focus in imaging and instrumentation. And then I did my master's in bioengineering.
I have a degree in mechanical engineering and a half a degree, which is also no degree, or master's in mechanical engineering as well. So
I was hoping you were going to do something like art history.
no, I do have a architecture and design minor. That is.
Oh. Do you find that to be helpful? More of the
I find that sketching out a lot of my design work and my solutions for things helps communicate those to others. So I actually do utilize that.
Yeah, sorry, not to derail, but I actually have always found that my ecology background has helped a lot because now I'm a systems engineer, so I work a lot with complex systems, and there's not too much more complex than like the human body and interaction with like the environment and stuff. Anyway, go ahead, Matt.
No, just to bring up the engineering at the end here. So I got an electrical engineering undergrad, and then after about 9 years, went and got my MBA to learn more about the business side of the business.
Good question.
I think that's it. All other questions?
Great questions, everyone.
Well,
Oh,
Sorry, one more.
one more.
About classes. Does everybody think had the best impact for their job?
Statistics.
Oh, yeah, that's true.
I only took one, but I wish I would have had more. Statistics is probably the most applicable.
Yeah.
Trying to think of other ones.
Yeah. And this is a really common answer, but a lot of it's just that work, like that time management and stuff you learn in college is really impactful when you start your career.
Yeah, I found the classes that had kind of projects that are similar to what we're doing now, either as end of semester projects or throughout the semester, like your senior project or even a junior class. I know in one of my materials classes, at the end of the year, instead of a final, we had to make remote control cars and make sure they didn't break when you run them into walls. Those are probably the most applicable to what we do today. It's really fun. I mean, it just feels like a big project at the end of the day. So yeah.
Genetics was my favorite though, because now I can tell people why they have blue or brown eyes. So that's applicable just to trivia life.
And so I think actually probably most beneficial for me was as I was in my master's, I was already working at a med device company at that time. So I was able to tailor things a lot to what I was doing. So I took a number of classes that were very anatomy based. I took an advanced anatomy class in my master's program that was really, really good. That kind of helped me with a lot of the small body details that I didn't have for my other mechanical stuff.
Yeah, I took a graduate level course too that was advanced anatomy. That was very, very helpful.
And I'll just recommend to seriously consider doing internships. I actually, aside from coursework being extremely important, college prepping you for what the real life is going to be, an internship really marries those two together. So you actually get to understand what the real working world is like in one small summer 12-week program. So highly recommend the internship, which Boston has a lot of internships. Please look us up at career fairs and come say hi. I can't do it in person right now, but we are doing virtual career fairs.
Yeah, informational interviews are also a great way to learn about kind of what career path you want to do. I did a bunch of those before heading into college as well throughout college. I think you have in your mind what you think maybe an engineer does on a day-to-day basis, and it's really helpful to get either now virtually or on site at a company and get to kind of meet some of the engineers and see what they do on a day-to-day basis.
Yeah, Viola brings up a really good point. Part of what we were trying to articulate here for you today is that, you know, there's lots of different ways engineers can plug into. And one thing we didn't even really get into this, we don't do here, but there's also like a whole host of engineers that work with the devices once they're out in the field that actually work with physicians and patients every day, like pacemakers. You have someone, an engineer that's along with them helping to program it and run the device, or even running our IVUS systems that sometimes be out in the field and help work with the devices directly. So engineers show up everywhere, all over the place.
Another question, how did you all pick the college you went to?
Oh, man.
My answer is silly, so I don't. I just went where my brother went. It sounded like a good idea. It was somewhat close to home. And I would say for me, it was a big one was cost. that I wanted to do. Minnesota had a reciprocity, and I wanted to stick with an in-state tuition, so I wasn't paying all the state prices. Practical. I went for practical.
Mine was definitely the program. I actually, they say what the average person switches 5 times in their college career to a different major. I was stuttered at one point in time. Don't quote that. But on the other side of that, I really actually got, I was actually looking at kind of an industrial design kind of thing where I was doing that. I actually kind of found a lot of that with mechanical engineering. And so talking to the school that I ended up going to about what program I wanted to be in and what I wanted to do, they kind of sold me on that. So that's kind of the reason I went there.
For me, I went into biomedical engineering, so I did pick a college that was top for biomedical engineering specifically. And I also kind of wanted a little bit further from home. So I actually went, I grew up in the West Coast, went all the way to the East Coast to get that distance.
You did the opposite. I just
Yes.
followed my brother traveling, and I was like, nope, come back.
Yeah, mine's similar. I chose a program that was really strong. I went to the University of Texas in Austin, and their mechanical engineering program definitely was a strength. I also loved the campus atmosphere. I liked the city it was in. I think that those are also kind of important characteristics of choosing a college. Talking to people who went to that college to kind of get the feel. Some colleges are more competitive than others, and some are more kind of a group team effort, I would say. And so kind of finding where you fit in that kind of league is helpful also.
I'm similar to Jenny. I stayed local. I went to the U of M here in the Twin Cities. My dad went there as an engineer, so I kind of followed in his footsteps. But I'm also part of the Boston Scientific recruiting team, and I'll just say we recruit from all over the place. So yes, we have a certain amount of key schools that we focus on, but for any other reasons, it's just we look for top talent all over. So choose a college that best most interests you, has good programs, has good social aspects. Is definitely a big. College is a really fun, important time of your life, and then come apply with Boston when you're ready.
Okay, I think I'll thank the Boston Scientific team. You guys did a great job with ultrasound. Really enjoyed the answers to your questions here. I think the important thing for students and kids to know is you can have this very diverse background. If you look at this team, it's a very diverse team. You can come together and really make a difference because you're not all the same. You don't all do the same exact jobs, but yet you can learn from one another. So hopefully the team showed you that today. We're very excited. I am going to turn it over to Randy.
Thank you, Steph. It's been a great opportunity here to learn a little bit more about healthcare, about medical devices, and about the work that this Boston Scientific team, is doing in peripheral interventions. It's a great opportunity to learn about peripheral, to learn about interventional cardiology, to learn about all different therapies that improve healthcare. The bigger medical device companies might work in neuroscience with the brain, endoscopy, urology with the digestive system and the urological system. Peripheral, the arteries away from the heart, interventional cardiology like we saw today with the vessels within the heart. Many opportunities to work in healthcare and really try and advance science. It's been fun to listen to the team respond to questions. I think that was maybe one of the highlights of the day, to hear about the team and their varied background and their colleges and their classes. But you can see that these teams work together. They collaborate, they innovate, they work as teams. They work to advance science and they work to bring new products to the market. One of the questions was how many new products are brought to market each year. In a larger medical device company like Boston Scientific, we might bring 100 new products to market every year across the 6 or 7 divisions that we have within the company. So it's a busy space. It sometimes takes a year, sometimes takes up to 8, 9, or 10 years to really develop a product, depending on how ready the technology is and how quickly it can come to market, whether or not there's a clinical trial required, and whether or not it can be approved by a regulatory body like the FDA. But it's a fun business to be in because you get to see every day how your work in developing medical devices or producing medical devices can really help people, can really help patients around the world. And as discussed by this team, there were a lot of engineers, but you might be a scientist or a technician, or you might be interested in finance or business or marketing or sales, or you might be interested in regulatory or clinical or reimbursement. There's many, many areas to be involved in medical device development, depending on what you like best. And as a few pointed out in the Q&A session, feel free to experiment a bit with your career. Get into an area that you really like, whether it's engineering or computer science or business, and then look for how that specialty might fit into the world of medical devices and how you might be a part of this ecosystem and this community that brings healthcare improvements to patients around the world. Steph and I have really enjoyed being part of this today. It's fun to interact with the students. It's fun to really talk a little bit about what we do at Boston Scientific and how we picked our colleges and how we advanced our careers and what we do today. You have all of that to look forward to. I think the key right now is to stay in school, understand your passion, get ready for that next step as you think about a college and a university, and keep thinking about career opportunities where you can apply the things that you really enjoy in a field that makes a difference in the world. And healthcare, medical device is certainly one of those areas to consider long term. So thank you very much. We're at the end of today's program. Thanks for joining and all your thoughtful questions. If you have additional questions about the Advancing Sciences program, please email heartassoc.org, as shown on the screen, and we will ensure to follow up with you. Have a great rest of your day, and we'll see you back here tomorrow morning at 10:30 a.m. Thank you.